Hi everyone and good afternoon. My name is Nancee Jaffe and I am a Digestive Health Registered Dietitian at UCLA. And I want to welcome you to our webinar on bloating today. I deeply apologize for the delay. For those of you who are tuning in from Los Angeles, you know how bad the traffic can be. So unfortunately, my colleague Janelle Smith is stuck in that traffic, but she'll hopefully be here in the next couple minutes to join us. But we'll get started in the meantime. So we want to just remind you that if you're tuning in through Facebook and Twitter, you can always send us your questions. We actually request that you send us your questions during the course of the lecture as they're coming up, because at the very end, we'll take those questions and we'll try and answer as many of them as we can. So today we're talking about bloating. So a lot of patients come into our clinic and they say, it must have been something I ate. And we always like to tell patients it could be. So bloating actually has lots and lots of causes, and food can definitely be one of them. And what's amazing is how many people struggle with bloating. So when we look at the statistics, it's actually quite staggering. So even in patients who do not complain normally of digestive issues, they're not working with a gastroenterologist, they're feeling pretty good, they say up to 30% that they are having symptoms. And here's Janelle, yay! So we were just talking about how common bloating is.
Hello.
So would you like to finish up on this slide?
Absolutely, I would. Yes, so about a third of people do complain of bloating. That's just for anyone in the general population, but actually for those with irritable bowel syndrome, between 75 and 95% of people with IBS complain of bloating. We know that it's more common in women.
God, that's so many. Isn't that amazing how many people suffer from bloating?
It is. And really it's the second most mentioned symptom after pain.
Which is amazing that it even trumps the altered bowel habits.
Absolutely.
Yeah.
So this is very significant for our patients, and we know that it affects people with functional dyspepsia and constipation as well.
All right. And so one thing I know I always like to talk with patients about is kind of the difference between the symptom of bloating and the symptom of distension, right? So when we think of bloating, it's actually a pressure. So people will talk about feeling a pressure in their abdomen, whereas abdominal distension is actually that girth change, right? We could actually take a measuring tape and we could measure how far out they are bloated or distended, I'm sorry.
Mm-hmm.
Oh, I love the image you chose for this slide, Janelle.
I just find that my patients tell me they wish that I had like a pin that I could just pop the balloon that's in their stomach. And I do wish it was that easy and that I had that type of pin. So a lot of times physicians will start the process with ordering procedures, seeing if there are any underlying causes to the bloating. They may do some breath testing to see if there's any kind of abnormal bacteria or sugar malabsorption. But as dietitians, what we can do is really look to the common foods that cause bloating and gas. And we're very familiar with these, and if we can modify them, we can really reduce bloating symptoms. For those people who have constipation, we know that resolving the constipation and having regular bowel movements will actually do a lot to relieve bloating as well.
So when we think about food triggers, I know as a dietitian, I often start with the low FODMAP diet. Is that true for you as well? Yeah, so when we think about the low FODMAP diet, which is actually a diet that deals with 5 very specific sugars, and we've actually underlined them here for you. So you can see that they're the fructans, the GOS, also known as galacto-oligosaccharides, lactose, fructose, and then polyols, also sometimes called sugar alcohols. And what we find is that these 5 sugars have something in common, which is they're all small. They move very quickly through the gut. They can pull water with them. They can also get fermented, which means broken down by the colonic bacteria, the bacteria that live in our gut, the good bacteria that live in our gut. And this will create that symptom of gas and bloating. And so oftentimes, when we talk about the low FODMAP diet and these sugars, we talk about a bucket filling effect. So a lot of patients will describe feeling really good when they first wake up in the morning, and then as the day goes on and they're eating more and more food, the symptoms start to show up. And a lot of patients will say, I wake up with a flat tummy in the morning, and by the time I go to sleep, I'm out to here, right? I mean, how often do we hear that? And yeah, so we call this filling effect of the bucket because all of these sugars are going into the same location. And so we want to really help patients to not overfill their bucket, as we like to say.
So here are the foods that we primarily look at for targeting FODMAPs. As you can see, we have the same sugars here: lactose, fructose, fructans, and galacto-oligosaccharides and polyols. And there are so many commonly eaten foods that are in these categories that it's really not one single food trigger that's causing the bloating. We would have an additive effect from foods like milk and yogurt, apples or honey. Then the biggest ones in all of our food, I would say, is onion and garlic and all of our sauces and flavorful things. Yeah. Wheat, which is so widespread. Even chamomile tea, which so many people use to help their tummy, can have some of these sugars. We've known for a long time that sugar alcohols can contribute to gas, but they're also naturally found in some fruits and vegetables.
Absolutely. And what's nice is that, this diet now has been around for a little over a decade, or at least the research on it has been around for a little over a decade. And we're starting to look at these sugars more specifically for what it is they do in the body. So do all patients need to be on a full low FODMAP diet, or maybe we can modify it based on their symptoms, right? So what I love is this is a chart from Kate Scarlotta, and we're going to talk more about her later and how wonderful she is with this diet. But what we found is that different sugars have different effects. So you'll notice we have the word osmotic effect, which actually means pulling water into the gut. And this is most likely to lead to things like diarrhea or loose stool, right? And then we've got fermentation, which we talked about, which is when the good bacteria in our gut are breaking down different types of products, including these sugars. And you'll notice when you see something with a 3+, that means it's doing a really good job of that. So unfortunately, when we look at our FOS, which is our fructans, and our GOS, those are the ones most likely to create the gas and the bloating. And we really put lactose in that category as well, because it really can create that problem symptom as well.
So let's say someone mainly needs to look at the foods that are causing gas and bloating, and they're really not having any bowel changes or watery stools. We can focus on just the high lactose and the high fructan and galacto-oligosaccharide foods. So that automatically makes the diet limitations even less than typical.
But when I look at this, like half of my favorite foods are here. So what is a patient supposed to eat?
Well, let's show them. So here are foods that are all low FODMAP versions in these sugars. And you'll notice that this list is actually a lot longer than the foods to avoid list, which I think is great to point out. We have so many lactose-free versions of dairy these days, whether it's cow's milk treated with the enzyme or it's almond milk or coconut milk product. And most cheese is actually very, very low in lactose and tolerated. There are some kind of milky cheeses that we do have to avoid on this diet. And then so many fruits and vegetables and nuts and seeds and things high in fiber that are just so healthy for our gut bacteria that do not produce as much gas in the gut. So really all so many vegetables are allowed on this diet, and it can be a very healthy, balanced diet.
And it's really nice because one thing I commonly hear is how restrictive the low FODMAP diet is. And when you look at a list like this, it really doesn't feel that restricted. Yeah.
So here are several resources that we recommend aside from ourselves. It can definitely be very helpful to meet with a dietitian to undertake this diet and to make sure that you're going in the right direction. Some resources that are very credible and we really respect are Kate Scarlotta, which we mentioned, an iPhone app, and a couple other websites that we encourage you to check out.
So is this meant to be a long-term solution?
It is not, Nancee. Okay. Thank you for mentioning that.
Sure.
The low FODMAP diet is intended to be a temporary elimination, a kind of break from the overload of this full bucket. And then after we've emptied the bucket, we're going to gradually add everything back in levels that's not going to overflow the bucket. So we are going to be able to include most of these foods in some amounts depending on the patient's tolerance.
Perfect. Another good reason to meet with a dietitian to do this diet, right? So I often get patients who will say that they tried the low FODMAP diet, but it may have helped somewhat, but they're still having symptoms. And so we saw, as Janelle pointed out so beautifully, that reducing or removing lactose from the diet can be very helpful. But there is another element to our dairy products that potentially could be triggering for the GI tract. So oftentimes patients will try lactose-free and it works. But for those that try lactose-free and it doesn't, this is when milk intolerance is something that we start to look at. So when we talk about lactose intolerance, we're looking at the sugar lactose. With milk intolerance, we're actually talking about a very specific protein that's found in some of our dairy products, and it's known as alpha-1 beta-casein. And this makes up about a quarter of the protein, maybe a third of the protein that we see in our milk products. What's interesting is that it's naturally low in sheep's milk and goat's milk and even breast milk. So I often hear from patients, how come I can tolerate goat's milk, but I can't tolerate cow's milk very well? It may actually be this protein structure. So this is something we might want to consider if patients are still getting bloated, even despite going lactose-free. And I have to say, one of my favorite things to look at with our patients, especially the ones that are talking about that kind of rotten egg smelling gas, which is really embarrassing. And it's definitely something we want to try and help our patients with. If you're smelling rotten eggs, it's usually pointing to the fact that there's some sulfur coming out of your body as hydrogen sulfide gas. And there's several reasons why this could be happening, but one of the most common is that there are lots and lots of foods, as you can see, that contain amino acids, which are basically the building blocks of our protein structures that have this sulfur compound, and we can only utilize so much in the body. And so what will happen is it gets combined with hydrogen in our colons and it comes out as this hydrogen sulfide gas. We also find it's naturally high in certain types of vegetables, such as what we call the cruciferous vegetables. So things like what you're seeing here, cabbage and Brussels sprouts, cauliflower and broccoli. It's also found naturally in our alliums, which are the different types of onion and garlic, leeks and shallots that we see as well. So I always like to remind patients that doesn't necessarily mean you have to cut all of these foods out of the diet. As dietitians, we always want to keep the diet as least restrictive as humanly possible, right? We just want to reduce symptoms. We don't want to reduce quality of life while we do it. And so this is where things like simethicone and activated charcoal can be so useful. So what we found is that simethicone actually helps to break apart gas bubbles, just allows it to leave the large intestine a lot easier, right? So it doesn't actually get rid of the gas, it just helps you to pass it, which in and of itself can be wonderful because sometimes bloating is really painful. It can be really uncomfortable trying to pass all that gas. Activated charcoal actually is really good at absorbing, and it can absorb some of that sulfur smell. Which is kind of nice, right? So this is something that we've actually seen in research studies can have significant benefit. Granted, we mentioned that the studies are limited at this point in time. We've also seen that when you combine the two, you get an even better effect, right? So if you're helping to shrink the gas bubbles and then absorb them, it's kind of nice. Although I have to say my favorite, charcoal pant underwear. I haven't tried them yet, have you?
Those are so cute. I need a pair.
I think they'd be great stocking stuffers, don't you?
Great idea.
There we go.
Great
All
idea.
right.
Okay, so now that we've talked about food triggers, we're going to go on to some other aids that may help in reducing gassing bloating, in addition to the simethicone and the charcoal. So we also have a few digestive enzymes that can help break down those sugars that are, not well absorbed and they're fermented by our colonic bacteria. If we can break them down before the bacteria get to them, they can't produce that gas.
Fantastic.
So we have two effective enzymes that are over the counter. The first is alpha-galactosidase. That works on the galacto-oligosaccharides. If you remember that third category in the chart. And this is mainly beans and legumes. So taking about 300 units of this enzyme with a serving of beans or legumes can be very effective at reducing gas and
how nice
bloating.
to be able to bring those foods back into the diet.
Yeah, because they're so healthy and they're great for blood sugar control, heart health.
Yeah, lowering cholesterol.
Exactly.
Good for the colon.
Exactly.
And then you don't get the bloat. That's great.
And then the other enzyme we have that has effective results is lactase. And also known as beta-galactosidase. But the lactase enzyme is going to work on breaking apart that lactose sugar molecule so that the colonic bacteria can't ferment it. And so for about a serving and a half of dairy, we use about 3,000 units of the lactase enzyme, and you would take these with the meal that you're eating that food in.
Will it work after?
It won't work after. It has to mix with the food at the beginning of the meal.
So probably not wise to also take it like 20 minutes before I go to the restaurant to order my bean dish?
That won't work either. Okay. With the first bite of food is best.
Fantastic.
And then finally, we have a couple herbal supplements that have some pretty good research showing that they can help in the feelings of gas and bloating, because some of what is troubling about bloating is that pressure, is that sensation. So we know that peppermint, especially if it's encapsulated and we can ingest it, and it opens up in our intestines, and those little peppermint molecules kind of soothe our gut. We know that it can help decrease muscle contractions in the gut. It can slow down motility, and so kind of prevent loose stools for some people. And it also prevents excess flatulence and passing gas. For some, it can help also reduce their nausea. So we often will recommend our patients to try these peppermint products a few times a day or in conjunction with meals. And then the last herbal supplement that is also helpful is called STW5. It's actually a combination of 20 different herbs that has a decent amount of evidence showing that it can really help with reducing the sensation of dyspepsia, fullness, over kind of tension in the stomach.
Yeah, and it's nice because it also is what we call prokinetic. So just like this can maybe help with the diarrhea, this could help with the constipation a little bit, which is kind of nice. How do you recommend patients take the peppermint? Like, is it like the enzyme and I should take it like right at that first bite of the meal?
So with the peppermint, we actually need to take it not with food so that the capsule doesn't open up in the stomach and release. We want it to wait until it gets all the way down to the intestine. So it's recommended to take them at least 30 minutes before or after a meal.
Yeah, I've had several patients come in saying that they tried peppermint capsules, but they took it right with the meal and they got reflux. And so they were really unhappy. And it's like, yeah, you have to take it separate from the food or you might get some heartburn, which is the unwelcome side effect. Well, thank you so much for joining us today. I'm Nancee Jaffe, and this is Janelle Smith, and we would love to see you in our clinic. So Janelle works in our Santa Monica GI office, and I'm in Westwood. And here are our phone numbers, so feel free to call us for an appointment. And also, we're happy to take your questions, so we're going to actually grab the iPad right there. And Janelle, you can be in charge of whatever questions you want us to answer today.
Okay. Let's see. So one question from our audience, why do I sometimes look 3 months pregnant after meals?
There we go.
So like we were talking about, there can be a sensation of bloating or there can be distension. And so typically when people complain of looking pregnant, that's the distension we're talking about. And that's just a physiological response to the pressure. It doesn't necessarily mean that there's more gas than if you had distension or not. But it's how your body's reacting to the stress of having that pressure in there.
And something that's interesting is, patients can have both bloating and distension, or they could have one or the other. And if they're just having the distension, this could actually be pointing to an issue with the diaphragm, right? So, there's so many causes of bloating, and we really kind of focused in just on food triggers today. But when there's a weak diaphragm, it can actually, which I should mention is a big muscle, it helps our lungs to go up and down. But when that muscle gets weak and it pushes down, it actually pops the abdominal muscles out. And that can create that feeling of distension. But patients will often say, I don't feel bloated. I just feel distended. So it's really important that we understand if they're bloated, distended, or both, right?
Right.
Yeah.
And then I'm assuming that we can strengthen the diaphragm?
We can. So there's actually diaphragmatic breathing exercises. And what's great is we're actually creating an integrative program in GI where we have a mindfulness teacher who is wonderful, Suzanne Smith, and she can actually work with our patients on these breathing techniques. And we can also send them home with videos and pamphlets pamphlets and handouts, and we can even practice in the clinic. That's
awesome.
Pretty nice.
Don't have to look pregnant.
No, unless you are, and then go for it.
Let's see. I've been told I have a lot of methane gas in my stomach. Can you suggest anything?
All right.
So a lot of times the talking about methane gas is that whatever the bacteria are in your gut are very good at breaking down things and producing methane as a byproduct. So there are a few different gases, a few different main gases that our gut bacteria will produce. And so someone might have more of the bacteria that produce methane.
Right.
This tends to be found in people who have kind of slower motility, more of the constipation predominant. So what would you recommend, Nancee, for someone like this?
So for those in our audience who don't know what we're talking about, so we're talking about small intestinal bacterial overgrowth, right? And so this is when there can be an overgrowth of different types of microorganisms in the small intestine, when really they're meant to be in the large intestine, right? And the small intestine is a much quicker environment. So these bacteria that end up from the large intestine into the small, they get riled up, right? And it can create some problems. With methane predominant, we're actually talking about archaea, right? So it's a very specific type of bacteria that produces this methane gas as a byproduct, which does indeed slow down the system. So I love using a prokinetic in these patients, right? And the prokinetic that I love to use, we'll see if I can get back there quickly, is that iberogas that Janelle talked about at the very end of our slides here. So actually,
STW5.
So I'm sorry, STW5. So this is actually a really great supplement. You can see it in the image there. It can help to kind of flush the system out and move it forward. And then I don't know about you, I still like to use the low FODMAP diet in these patients. Is that what you would do?
I do.
Yeah, it's hard because there's not good research there's actually like no research on diet and small intestinal bacterial overgrowth at this point in time. But I find that it's fairly successful. How about you?
Yeah, especially I think the very gas-producing categories of the FODMAPs I find can be very helpful in relieving symptoms.
Yeah. Good.
All right, we have time for one more. What is the suggested protocol for using activated charcoal to relieve bloating?
Fantastic. Yeah, so usually activated charcoal, each capsule is around 200 to 250 milligrams. And so I always like to start really slow. And I like to see, will one take care of it for the patient? And usually the recommendation is you could take it with a meal, but I often find it works a little bit better when you're having symptoms to start taking it. And again, you can always add a second one on top of that if needed. And technically it can be done up to 3 times per day if necessary. The problem is that it can turn the stool black. So we always like to forewarn patients that it possibly could turn the stool black. The other part of it is it's an absorber. So we always want to make sure that it's not going to interfere with medications that are being taken or supplements that are being taken. So this is why you would also want to work with a dietitian to make sure that the protocol for the activated charcoal works well with any other issues that you might be dealing with or conditions you might be dealing with. Do you use it any differently, or is that kind of how you're using it right now?
That tends to be how I use it. Yeah. If someone is expecting to have gas between a particular or around a particular meal in the day, we may start it regularly before that meal. But I will often have patients just start it when they're having symptoms, and it usually brings relief in about 30 minutes, I would say.
Yeah, that sounds good. Great. So should we wrap it up? All right. Well, thank you so much for joining us. It was really a pleasure to be with you here today, and hopefully we'll see people in clinic soon. All right,
thank you.